So I decided to do my video on clinical interpreting just because the last few years I've been able to travel to different places to help with clinical interpreting, and also I've worked in the Provo area with different doctors interpreting for Spanish, and I've worked in like Guatemala and some other countries in Central America. So it's something that interests me, and so I made kind of a list of some of the different points that are important for clinical interpreting. The first one is accuracy and completeness. It's important to give the exact message that the doctor gives without adding or omitting or distorting anything they say. It's important to interpret word for word, and also to copy the tone and the intent that they speak with, and also to clarify medical terminology to make sure that all parties understand what's being said. The next one's confidentiality. It's important to follow HIPAA and not give anything away that's private or any private information. Not to disclose any information outside of a medical setting. The next one is neutrality and impartiality. It's important to remain neutral and not express any personal opinions or judgments, and avoid taking sides. Just because you're just there as the interpreter, you're not there to express your opinion or anything like that. The next point is cultural sensitivity. It's important to respect different cultures because that can influence just how people communicate, and avoid, like we've talked about, stereotyping and remain respectful of diverse beliefs and different values and practices. It's important to provide to not provide any personal advice or counseling or anything like that, and to try not to form any relationships with patients. And that can be hard sometimes, but it's not really your job. It's just your job to be there to interpret, to help the doctor or the medical professional. Being transparent is important as well. It's important to make sure that any potential conflicts of interest are disclosed, and also to inform both parties when clarification or intervention is necessary if one party doesn't understand the term or needs some kind of cultural context. It's also important to continue to develop professionally in that sense, to like keep up on terminology and interpreting techniques and things like that, and then also to get certified. The main certification is from the National Board for Certification of Medical Interpreters, and there's also the Certification Commission for Healthcare Interpreters. Let's see. And the biggest one is also to just recognize personal limitations, and if there's a word or something that you don't know, to step back and like let both parties know so that you can figure it out and just request further assistance when is necessary. And those are just kind of some of the bigger points that help with learning how to interpret in a clinical setting. And if you follow those, then you'll be able to learn. And it's really cool, and it's brought a lot of knowledge and good opportunities being able to learn to interpret in a clinical setting. So it's a really cool experience, and I enjoyed it.